Hello, good morning, my friends, viewers out there. My name is Dr. Novitz, the gynecologist, as usual. On this episode, I will be talking to us about female genital mutilation and the associated societal problems that it brings. Female genital mutilation, as the name implies, is a cruel practice that is still being carried out in certain remote centers in some part of the world. It is associated with great uh, mental health challenge, and that is why it is very, very important. It has both problem associated with obstetric practice as well as gynecologic problems. So, on this episode, I'll be shedding light on female genital mutilation. Female genital mutilation actually is any act that has to do with inflicting injuries on female external genitalia, that is the vagina, the vulva, whereby the clitoris, the labia minora, the labia majora, or even the vagina itself may be removed either partially or completely. And in most cases, sometimes there might be, resuturing of the vaginal opening to the point that it may become closed, leaving the woman with so much, psychological, impact and mental disturbances and a lot of other related problems. It is classified into grade 1, type 2, type 3, and type 4, depending on the extent of destruction of the female external genitalia. So you don't really need these types, but it is important for us to appreciate the challenges that this practice brings to women, as far as when they are pregnant, and also before they become pregnant. Let me start with the one that has to do with a woman that is not yet pregnant. When a woman's female external genitalia are removed completely or maybe partially, first, it has to do with giving the woman undue pain. The woman has undue pain. Some women may bleed, if not properly handled, they may bleed to death. Some women may suffer some form of sexually transmitted disease like HIV, syphilis, hepatitis B, as the case may be. Because most times the practice usually has to do with unsterilized instruments are usually used in the process, thereby exposing people to, at risk of some of those infections. And then you find out that when these organs or the structures in the external genitalia are removed, the wound so created then heals and forms fibrosis, and then in most cases some people will suffer infections that will now make the patient to start having some form of complications that has to do with the narrowing of the vagina. We call it acquired gynetrasia. And when the woman has narrowing of the vagina, it will now translate to other gynecological problems like reduced libido, reduced sexual drive, and even when eventually the woman attempts to have sexual intercourse, the woman will now be having painful superficial intercourse, and because of that, the woman may now be afraid to having frequent sexual intercourse with her partner. So from there you now have marital disharmonies, and then even issues with fertility, because the less frequent the woman engages in sexual intercourse, the more likely the woman is at risk of having fertility challenges. And then before you know it, there will be marital disharmony. And then in the extreme of cases, you could have instances where, depending on where this procedure is carried out or who did it, by which personnel and the instrument used, the women can also suffer what we call vesico-vaginal fistula, which comes with a lot of other soft tissue damages like the bladder and other structures. And then still on this female genital mutilation, the people who are victims of female genital mutilation are usually victims of stigmatization and then mental and psychological disturbances because they are withdrawn to themselves. It can even lead to psychological, psychiatric problems, as the case may be, depending on the level of, depression that the person becomes, the person later have. And then apart from all these problems, you find out that when a woman eventually becomes pregnant, it also brings other related problems whereby the woman finds it difficult to experience a smooth and labor process, so that eventually, even when she carries the pregnancy to a level where she's supposed to deliver, it becomes difficult for this woman to undergo a smooth labor process, because the perineum, which is the entire aspect, lower part of her reproductive tract, is tightened, and in which case certain maneuvers may need to be carried out before the woman can be able to carry out the process of delivery effectively. Um, you can have this whole process affecting both the baby and also affecting the mother, because if labor becomes unnecessarily or unduly prolonged, the baby may stay in the abdomen or in the womb for too long, and as such, even when delivered to the external wall, may suffer some form of morbidities. Then the mother also may bleed in the course of delivery, because in the course of attempting to work on the scars that have been created by this female genital mutilation, the woman may become at risk of bleeding to warrant even transfusion in some cases. So, arising from this discussion, I want to advocate that the scourge or the dangers of female genital mutilation is not just only to the individual that is the victim, but it affects the individual, the family, and the society at large. So there is need for us to come up with advocacy programs in order to stem the tides caused by this female genital mutilation, in order to prevent all the traumas, the pains, the morbidities that is always associated with this program. As time goes on, I will continue bringing forth valuable and useful discussions that are very, very pertinent as far as our female overall health is concerned. Thank you very much for listening on this episode, as this marks the end of this discussion. Thank you.